Understanding the symptoms and identifying the solution that suit your period pain. Knowledge about period is be scared. An expert in this field do not even talk about it. This is why I have took it upon myself to assist you. Let's start while cycling of your period. It is very important to take record of your cycling life. A lady should be able to know when she ovulate, when our next bleeding will start, how long does my bleeding last, what have changed in my cycle. If you are able to answer this question, then you are one step ahead. But if not, don't worry, I will help you. The next stage is understanding the symptoms. Most women lacks the knowledge about this because it varies among them. The cycling of Lady B is different from Lady A. This is where the confusion starts. Lady B use one pad for her bleeding, where Lady A use 1.5. So when Lady B is experiencing heavy bleeding using 1.5 to 2 pad for her bleeding, Lady A will consider it as normal due to her personal cycle. That is why you need to understand your cycle. This will help to discover period symptom whenever they come and definitely making it easier for you to solve. Let me help you identify the types of menstrual issue and their symptoms so that you can just keep record. Heavy bleeding, menstrual pain, dysmenorrhea, premenstrual syndrome, PMS, unusual discharge, absent period, amenorrhea, and menstrual migrants. Let me explain. Premenstrual syndrome, PMS, and absent period, amenorrhea. Premenstrual syndrome, PMS, this type of menstrual pain usually start a day or two before your period, which make you experience some of the following symptoms: hot flash, bloating, anxiety, depression, irritability, change in appetite, fluid retention, swelling in ankle and feet, headache, and some few others. Presently we cannot undergo any medical lab test to identify premenstrual syndrome. The perfect way to diagnose PMS is to keep record of your cycle symptoms. Solution: lifestyle change. Limit the intake of salt. Eat food that contains high complex carbohydrates, peas, whole grains, vegetables, etc. Eat food that is rich in calcium. Avoid intake of alcohol and caffeine. Don't eat heavy food, eat bit by bit frequently to help reduce bloating. Supplement. Supplements such as calcium, magnesium, vitamin E, and vitamin B6. These supplements have been studied and have a positive effect of removing PMS symptom. And now, absent period, amenorrhea. Absent period, amenorrhea, is usually referred to as absent period. If your period stopped flowing for 3 months, and you are not pregnant or you are at the age of puberty, and you are yet to see your period, that means you are having amenorrhea. This is usually caused by medication, drug, or some medical problem like antipsychotics, cancer chemotherapy, antidepressants, blood pressure drugs, allergy medications. Symptoms of amenorrhea: milky nipple discharge, hair loss, a headache, vision changes, additional facial hair. Some lifestyle factors, such as too much exercise or too little food, can cause amenorrhea, so strive for balance in work, recreation and rest. Assess areas of stress and conflict in your life. If you can't decrease stress on your own, ask for help from family, friends or your doctor. Solution: changes lifestyle and diet. Stress: relieve yourself from stress. Excessive weight loss, hormonal replacement therapy, and lot more. Let me not bore you with list of solutions. I have prepared for you a book that, here is the catch. The End of Menstrual Pain. Treat your pain without complications. These are some of the reason why you will want to read this book. To slow down your old age. To overcome menstrual cramps pain. To have a healthy weight maintenance. To beat premenstrual syndrome. To do away with infection. No more missing period. To identify when your hormones are out of place. To achieve great sex satisfaction. To beat floating. To deal with stress and anxiety. To regulate your period. To know the secret of making babies. To do away with infection. To identify the food that suit your period issue. And lots more. Let's see what is actually inside the End of Menstrual Pain. 1. The female body. This part of the book will feed you with information about your sex and reproductive organs. Also, you will understand the process of menstrual cycle. 2. Period issue. This section deals with the various types of period issues, which helps you to identify your own and how to treat it. 3. Birth control pills. A detailed explanation on how birth control pills works and the various methods of preventing pregnancy. 4. Natural supplement. What you will gain from this section are varieties of natural supplements use in curing a particular period problem, its dosage and others. 5. Herbal treatment. This section consists of herbal solutions to help you tackle your period issue. 6. Infertility. Solution to infertility will be revealed to you. 7. List of drugs, supplement and herbs produced with recommended daily dosage that have been tested by many women. And lots more. Remember the saying of Mahatma Gandhi, "It is health that is real wealth and not piece of golden sliver." Fill the form below to have access to the book.